And thanks for joining us tonight. For the second straight year, COVID was the third leading cause of death in the U.S. in 2021. That's according to data released today by the CDC. Only heart disease and cancer killed more Americans last year. In Wisconsin, nearly 6,000 people died from the virus last year. More than 14,000 Wisconsinites have died since the start of the pandemic. And that report comes the same day Dane County moved in the wrong direction, back up to a medium level of COVID activity as defined by the CDC. As Logan Reichstead explains, health officials are not yet sounding the alarm.
Our rise in case activity has been happening for more than a few weeks, and our hospitalizations have stayed relatively low.
And as of today, Dane County is now one of 3 counties in the state sitting at the medium level of COVID-19 in the community, according to the CDC.
Although we are not nearly at the levels that we have been before, we're starting to see just a slight uptick in our numbers of hospitalized patients. We haven't had any changes to our day-to-day operations right now.
One of the metrics the CDC now uses to calculate a community's COVID level is the percent of staffed inpatient beds being used by COVID patients, which in Dane County is 1.6%. Health officials say rising case numbers can predict an increase in COVID hospitalizations, so keeping those who test positive healthy enough to stay out of the hospital is key.
It's not necessarily meant to alarm our communities, but it's meant for us to start thinking about what are the things we need to do, which we all know, to reduce transmission.
And while health officials continue to urge people to get vaccinated and boosted, there's an increased push to treat patients early after they test positive, especially now that treatments are easier to come by. And Dr. Amy Franta from SSM Health says they're being underutilized.
So it doesn't replace vaccination, but it's another tool.
So that those protective factors that we have available to us, high vaccination rates, good access to treatments, and probably some immunity from previous COVID infection is keeping severe outcomes from achieving levels that we've seen in the past. And we really want that to be the thing that continues.
In Madison, Logan Reichstead, News 3 Now.
Earlier this week, UW Health and Unity Point Meriter hospitals announced plans to loosen visitor restrictions, which SSM Health did last month. The hospitals say they're not making any immediate changes to those policies, despite these higher community levels of COVID.